I'd like to welcome to the stage Nicole from Medicine, Nursing and Health Sciences, who will be speaking about restoring voice with therapy. Can a larynx change its spots? Please welcome Nicole.
What do these famous faces have in common? They have distinct voices. Some are nasal, some are smooth and deep, some are very powerful or have an incredible pitch range for singing. Each of these voices, indeed every human voice, has its own unique characteristics, and our voice is closely linked with our identity, our personality, and the way we are perceived by others. Can you imagine not being able to use your voice? Many people with voice problems report a significant impact on their emotional and psychological well-being, their social function, and their ability to do their job. A healthy voice depends upon a pair of efficiently functioning vocal folds within the structure of the larynx or voice box. My PhD research is investigating benign vocal fold lesions, lumps, bumps, and spots that can form on the vocal folds in response to trauma. And this trauma is usually the result of a person's vocal load, meaning how much they use their voice and the way in which they use their voice. Once these lesions form, little is known of their potential to change. Do they change in shape or size, or can they even disappear in response to factors like targeted voice exercise or a reduction in the person's vocal load? Presently, surgical removal is the typical recommendation for many of these lesions. However, previous research suggests that for somewhere between 30 and 67% of people, an improvement or complete restoration of vocal function can be achieved through voice therapy alone. My research is contributing much needed information about how these lesions change across time by tracking a group of people with the lesions over a period of 1 month. I'm also looking at how their voices respond to a session of heavy vocal load, sustained, loud talking, and to targeted voice exercise, for example, a lip trill. How am I measuring change? Each of my participants undergoes stroboscopy, a camera inserted through the mouth with a strobe light inside of it that lets us look at the vocal folds as they move in detail and track change across time, looking at factors like inflammation, the size of their lesion, and vascularity. If these lesions do change in response to these factors, the obvious implication is that some people will not require surgery, which lightens the psychological and financial burden on the person and our healthcare system, but also the surgical burden on the delicate structure of the vocal fold tissue. My research will help us begin to answer the question, can a larynx change its spots?
The final, our number one winner, Nicole Free.